Houston's plica test. Basically, you're looking for a medial plica. Jason, you could put your head that way. And this is one of those things where a lot of different stuff is going on. But we've practiced the medial and lateral rotation of the tibia by the heel hold. Okay, that's a good way to do this one, or you could take it up like that with your hand this way. But essentially, you need to figure out a way to internally rotate the tibia. All right, so we're bringing the tibia medially or internally rotated. I'm going to do it this way. It's more comfortable for me. It's all about me. And then I'm going to take the heel of my hand and I'm going to put it on the lateral patella. Okay? So if I'm taking the patella and I grab the femur and the tibia on the medial side and I squeeze it, I'm creating a medial glide to the patella. Okay? But you want to try to take the patella and move it medially as you palpate along the medial aspect of the patella over the femoral condyle. That's where the plica is. It's kind of tricky to squeeze that medially, and they have to relax and palpate. So I suggest that you use fingers 3, 4, and 5 to contact the medial femoral condyle to squeeze the patella like that. You see that? And the index finger to palpate right along there. And I go into flexion extension, and you see if you can feel a little clicking or movement across. And it feels like this ribbon or tubular-like folds that you're rubbing over. I mentioned like maybe a thick cardboard, piece of cardboard or index card that's been folded over, and you can rub your finger over it one way and you can't feel the crease, but you go the other way and you feel that little nub sort of click across it. And you're flexing and extending to let that tissue move underneath your finger. Your fingers kind of pretty much stay in a static position. Okay? So, again, internally rotate the tibia. All right? Take the patella and squeeze it medially. And then palpate with your finger, your index finger, on the medial side of the patella over the femoral condyle and see if you feel any clicking or snapping or anything. Okay? So that's the